Many students have been taken ill in Bengaluru. You know, when there is extreme heat coupled with a crisis, that is a water crisis, then such things are bound to happen. 47 students residing in the Bengaluru Medical College and Research Institute, or BMCRI Girls Hostel, were admitted to the Victoria Hospital with acute gastroenteritis, loose stomach and weakness. 4 of these students underwent treatment in the ICU, and the stool samples of all of them were sent for culture and sensitivity tests. There have been conflicting reports about what the ailment is. Is it just a stomach bug, or is it something else? Meanwhile, BMCRI Dean and Director Dr. Ramesh Krishna said that all the patients were stable. However, there is a difference of opinion between what the authorities are saying as against what the students are saying. Now, BMCRI PG students earlier claimed that over 80 girls had been admitted and that both the hostel and the college were facing, I beg your pardon, were facing a potential cholera outbreak, sharing photographs and videos of the hostel to highlight poor administration and water contamination in the hostel premises. The Dean Director also added that the ladies' hostel warden, whose name happens to be Dr. Akhilandeshwari, has been suspended, and how measures were put in place by the college, including disinfecting and closing the hostel kitchen, supplying filtered water to residents and supplying food and water to students from Victoria Hospital's kitchen. It is being said that the BMCRI also plans to replace the cook at the hostel, and how the hostel was indeed facing on various fronts due to an increase in student population. There was a bit of a confusion. You know what? To say it's an outbreak is not right, unless the authorities say it is one. But then whatever it is, it's made many students ill, even as the city has not piped down in terms of extreme heat and a severe water shortage. I'm going to now take you to the guest. I'm being joined by D. Randeep, who's Commissioner of Health and Family and Welfare, Government of Karnataka, and Dr. M.R.K. Ravi Chandra, who is Consultant Physician, Narayana Health, Mazumdar Shaw Medical Center. A very, very warm welcome to both of you. Dr. Ravi Chandra, thank you so much for joining, and also Mr. D. Randeep. Mr. D. Randeep, if I may come to you, what have you made, what do you make out of these students, 40 odd students who were admitted to hospitals after they complained of stomachache, vomiting, nausea, etc.? Mr. Randeep.
Yeah, this was an incident which occurred in the Bangalore Medical College and among the hostelites. And as you're aware, the Medical Education Department had immediately taken steps at their end in terms of putting corrective actions in place. And since it was a medical college, the hospital itself accommodated the students and then started running tests on the stool samples. Of all the people admitted, we could isolate the stool samples and confirm cholera for only 2 of them. Remaining all of them appeared to be serious ADD cases with diarrhea and loose stools. But the confirmatory culture test could be revealed only in 2 cases as cholera.
You're saying, because you know, Mr. Randeep, we were very careful and prudent not to say it's cholera. So you are saying 2 cases of cholera have been confirmed, sir?
Yeah, this 2, and in the city since January we have been tracking. It's not that we have been doing it now. But since January itself, our data shows that overall in the city, in the state as a whole, we are having about 14 cases. In April alone, we have had 4 to 5 odd cases, which also includes the 2 cases in BMCRA.
All right, let me come back to you. Doctor, let me come to you, Ravi Chandra. You know, the thing is that 2 cases of cholera, earlier he says there were 4 cases of cholera. Would you say it's an outbreak? Because obviously it could also be dovetailed into extreme heat, severe water shortage in Bengaluru, clusters living together, and of course the hostel itself is saying, you know, the cook has been sacked and the warden has been sacked. So there seems to be some unhygienic conditions in the hostel. Would you agree?
So first of all, very good evening there, ma'am, and good evening to Randeep, sir. It's a pleasure to be here to voice my opinion and, of course, also what we know as a fact from across Bangalore. I certainly do agree with Randeep, sir, that ever since January, there has been an uptick of acute gastroenteritis. Now, acute gastroenteritis is very common, and it is, as we all know, seasonal, and it's very dependent upon the environmental conditions. So, wherein there are, other factors which come in, such as water shortage, which is then compounded by a rush to supply water from unverified sources, this becomes a fertile ground for contamination. So once such kind of a contamination occurs, it is but natural for pathogens to spread. Acute gastroenteritis is an extremely common condition which is rampant across India and generally spikes during the summer months due to a combination of these factors. So I would say that it is not surprising that a condition like cholera has cropped up. It is not that it is something that has cropped up just now. It is most of these conditions are prevalent in the background, but some conditions will cause
But the thing is that it's scary, doctor. I mean, when you say cholera, it's scary. I know you have fantastic hospitals there, but the point is, someone stand up and take onus of the fact that this cholera outbreak, whether you want to call it an outbreak or an incidence, wouldn't have happened if we did not have other conditions like extreme heat, lack of water, etc., etc. I want to go to Mr. Randeep. Mr. Randeep, I want to ask you, sir, that is it still time? I do not know. I am asking, very humbly asking you that is it time before you announce it as an outbreak, Mr. Randeep?
No. See, look, for outbreak, we really need to have clustering of cases. We need to have two or more cases in a closed locality. We have not seen any such signs. I mean, these have been isolated cases in different parts of the city, as well as I think the only other district that we have seen is in Ramnagar and Bangalore urban, of course. So we are a long way away from saying there is a outbreak, and we do not want to unnecessarily cause panic among people. We just want to tell people to take precautions. As the doctor mentioned, it's summer season. It is expected. We have to have safe hygienic practices, ensure that the water is boiled before we drink, and the water we use for cooking also is extremely important. So definitely not to panic, but people need to be aware.
Yeah, absolutely. You said it absolutely correctly. People need to be aware and careful. But the point is, in a hostel where the cook has been sacked, there is a doubt that there were not hygienic conditions, and this is a medical college hostel. There was, there are lots of question marks. How are you going to ascertain that these things happen? Because as of now, what one is hearing is that the Victoria Hospital has been supplying them clean water and clean food to eat.
So this is a larger plan of ours to actually go and ensure that the hostels, maybe the larger educational institutions, anywhere where there is a large gathering of people and mass food is being delivered, to ensure that safety norms are being followed. So we have roped in even the food safety department as well as the local BBMP and health teams to go and do some checks across the city, just to ensure that quality is being maintained.
All right.
So this is a continuous activity.
Doctor, how do you now, there are only a few cases, but what if it spreads? I mean, what is the way out? I mean, you have to boil your water. We all have learnt it since we were children. But in a city which is coming up for water and can't even bathe more than, let's say, twice a week in certain localities, what do you think the state should do?
Yes, ma'am. So that's a very relevant question. I think we should use this platform to increase awareness, and that is what is the most important need of the hour. The awareness that in a season like this, acute gastroenteritis will flare, how to prevent it and what to do about it is what is most important. Now, how to prevent it, you have outlined very beautifully. Boil water, no matter what the source, no matter what the label on that bottle of the so-called mineral water we purchase. Boiling takes care of 99.99% of pathogens which can cause harmful illnesses. The second is what to do about it. Why do most of these patients end up in a hospital in a serious condition? It is because one very basic tenet of treatment is ignored on the very first day when the diarrhea crops up, and that is rehydration. To this day, there has been no medical intervention that has saved more lives than rehydration.
All right.
On the very day of this diarrhea, if people rehydrate sufficiently, and with a condition like cholera, we are talking about 5 to 6 liters of oral rehydration salts dissolved in water. So if that happens, then most of these cases ending up in hospital can be avoided, because at the very outset, these are mild illnesses which become complicated by the metabolic disturbances which are caused by the dehydration
All
that
right.
occurs.
Okay. Yeah. What you say is sounds very good. It's absolutely sounds right. That is what the thing is to do is. But the point is that, you know, things don't work like that all the time. These are students who were studying and maybe ignored it. But the point what the doctor is making is, first of all, what Mr. Randeep said, it's not an outbreak. So let's not panic. It's very important that we don't panic. Number two, like Dr. Ravi Chandra said, that we have to take enough precaution, because that is even better than cure. Let me thank both Randeep as well as Dr. Ravi Chandra for joining us on this broadcast. Thank you indeed.